Hello and welcome to another edition of Kaleidoscope right here on Channels Television. I'm Anne Nwawadu. On the program today, we sit with Professor Alashley Abimiku. She's the Executive Director, International Research Center of Excellence. Once again, welcome to Kaleidoscope. The Institute of Human Virology Nigeria is a non-governmental organization with an arm focused on research and training in the health sector. Let's tell you more. Established in 2004, the Institute of Human Virology Nigeria is a non-governmental organization which began its activities by developing infrastructure for treatments, care, prevention and support for people living with and those affected by HIV and AIDS. IHVN has now expanded its services to other infectious diseases like tuberculosis, malaria and non-infectious diseases, including cancers, which prompted the creation of the International Research Center of Excellence, IRCE, in 2015. The actualization of IRCE epitomizes the vision of IHVN and its prime position as leader in providing quality health services, capacity building, and health-related research in West Africa. The center is focused on providing training and engaging new researchers in its mentorship program aimed at improving the health sector in Nigeria. Let's now hear from the Executive Director, International Research Center of Excellence, Alashley Abimiku. The International Research Center of Excellence is an arm of the Institute of Human Virology in Nigeria. What prompted the creation of this arm and what is the objective?
As you know, the Institute of Human Virology Nigeria was created in 2004, although there were a number of activities, research activities that were going on in Nigeria before then, but officially it was in 2004. And at that time, it was created as an affiliate of the Institute of Human Virology, Baltimore, University of Maryland. And that is an institution that is solely dedicated to research. However, when we initiated the Institute of Human Virology Nigeria, it was really to deal with the local health challenge at that time, which is the incredible number of people that were dying as a result of HIV. And so our focus at that time, working with our collaborators in Nigeria, was to see what we can do to support the government to be able to roll out this at the time, very complicated clinical drug regimen, and then be able to set up laboratories that would also do the tests that are required. Now, this is, of course, with funding from the U.S. government under PEPFAR. Subsequently, as most African countries, Nigeria was able to kind of have a hold on HIV. Not many people were dying. A lot of people were on drugs and doing very well. And so we felt that at that time it was important for us also to ensure that the treatment program we had here in Nigeria was optimal, because now people are living for long. There are other complications coming in. And apart from that, there are other local health challenges that were in Nigeria. So for us to be able to inform the treatment that was being provided to individuals in Nigeria and cope with the newer health problems, it was very important that everything we did was informed by research. So we have the information, we have the data, and we have the evidence that this is the best for the citizens of Nigeria. So it was really very important that for the Institute of Human Virology Nigeria, after having supported the government to kind of close that tap of a number of people dying as a result of HIV, now turns its attention to conducting the research that will inform the best treatment regimen and that would also address some of the other challenges. So have the data that informs you of whatever we are doing to help the community within the country, and hence the importance of establishing the center within Institute of Human Virology Nigeria to address research questions and develop the data that the policymakers would need to really improve the health status of individuals here.
And what other sectors have you delved into? Has it been just HIV and AIDS?
We've done a lot on HIV, and we've done a lot also on HIV cousins, which is TB, because a lot of people that are infected with HIV also get co-infected with TB. So we've done a lot on TB as well, with funding, like I mentioned, from the U.S. government, but also from the Global Fund. So that's a number of the, maybe 80% of our efforts is really towards these two infectious diseases. Then, come with the epidemics and the pandemics. We have also supported the Nigeria Centers for Disease Control in addressing some of the newer emerging diseases that also affect individuals. Like I mentioned earlier, with people living longer, it means that all the non-infectious issues, like hypertension, diabetes, and stuff like that, would be important for the government to pay attention to. So now we're also looking at what are the risk factors for HIV-infected individuals, or not even, that is leading to some of these diseases that have to do with stroke, cardiovascular kind of infections, and diabetes and all of that. So really our focus has expanded over the year. We still focus on HIV, TB, and malaria because really, to be honest, in sub-Saharan Africa, that is our major challenge, health challenge. But then we're also cognizant of the fact that there are emerging and re-emerging infections, Ebola, SARS-CoV-2, Lassa, yellow fever, that we also have to support the government and citizens of Nigeria to deal with those.
And how have your activities over the years contributed to the development of the health sector in Nigeria?
Really good question. Now, when we established IHVN in 2004, it was really in collaboration with the government and agencies of Nigeria, health agencies of Nigeria, and health institutions as well. From the very beginning, one of the principles for IHVN is that we were going to be to make a difference to the health status of Nigerians. And the only way we can do that is really to work with the government, to work with health institutions, to work with research institutions as well, and universities and academia. So it's a very unique structure in the sense that it is very collaborative. So, and if you look at the structure of the institution and our 4 levels of laboratory infrastructure and the biorepository and the clinical trial unit, we had that at the back of our minds when we established it, this collaborative nature of doing work. And so what you see is core facilities that individuals can work together to conduct research. And then when it comes to improving the healthcare and management that the Institute is involved in, we work with health institutions because, the clinicians, the nurses, the laboratory personnel, the pharmacists, and all of those individuals, we work with them because it's really very important that the government sees IHVN, although it's an NGO, is a capacity that is for the government. and for the people of Nigeria. So it's not to replace anything that's out there. So if we have health institutions, whether they are tertiary, secondary, or primary, our role is to make them better the best way we can, either through funding, through training, or through mentorship. So it's that kind of partnership. And so whether we're looking at service programs, our service programs, or whether we're looking at our research activities, it's really done collaboratively across board. And we hope that this kind of model would be one that is accepted not only in Nigeria, but across Africa. Because we, for instance, if you look at Nigeria, there's so many universities. They're all involved in some ways of research, but they're too much in the silos. And it takes a lot to build that kind of infrastructure, especially the laboratory infrastructure to support research. So we believe our model that really focuses on collaboratively creating the infrastructure that we can all use and work together is really the one that will support the people, the citizens.
Since the establishment of the center back in 2015, how much effort have you put into research and training, and are you happy with the results so far?
We've put in a really significant amount of effort in ensuring that we have this infrastructure for research. And this takes me back to my earlier days when I finished my training, my postgraduate training in London, came back and was really very excited, at working, doing research. And the first 3 months or 6 months, I realized that there was no laboratory for me to do any research. And that was the reason did they say Jabba? I left the country and went and looked for a facility that I could really do research, but in the long run. So my passion has always been that infrastructure that allows the Nigerian scientists to be able to conduct research has to be part of the solution that IHVN is focused on. So when we set up the International Research Center of Excellence in 2015, that was very key on my mind. And that is why, if you look at this building, about 4 floors are really providing the kind of infrastructure, the laboratories, the clinical trial unit, the biorepositories, and everything that a researcher could be successful on. So that's one thing that we really paid attention to and provided. And people don't really necessarily have to Jabba. There are laboratories here that are comparable to anywhere in the world that they can work in. The second issue that we made sure we address is building capacity. So there were lots of trainings that we did in terms of how do you conduct and maintain the culture of research. Research that uses ethical norms, that is very sensitive to the culture that we're in and respectful, and also uses international standards, right? So it shouldn't matter whether this research is done in Nigeria or in the US. The results of the research should be credible and should inform the whole world. It shouldn't, because in science, if you submit your manuscript, is evaluated using international standards. So that was one thing that we were very careful about. First of all, we have to respect the culture. Second, we have to conduct research that is scientifically sound and really doesn't hurt the citizens that we're trying to protect. And then thirdly, the third thing that we did was to ensure that the leaders of the science are coming from the young Nigerians that are really interested in research, that are well-trained and have a scientific research mind, but have never had the opportunity to really ask those questions and probe.
Welcome back. You're still watching Kaleidoscope on Channels Television. We continue the conversation now on the health sector in Nigeria with Professor Alashle Abimiku.
And like I mentioned, most of the people that live the country, it's not out of choice. It's because, you know, they don't have the appropriate environment or the infrastructure to do that work. And then the established ones, we work with established researchers to continue to bring up the young ones. So that, you know, it's really a pool of minds that will solve our problems. So that's what we've done after setting up this research center in 2015. And I must say, based on the data that we have now, in the sense that we've got a pool of faculty, what we call faculty, these are young researchers that are really competing with the rest of the world and being successful in getting their research grants. We've moved for about a couple or two or so in 2015 to about a faculty of 20. We've got 20 Nigerians now within the center that are getting their own grants and doing their studies. We currently have about 40 grants that are ongoing on the different areas. We've got grants on HIV, TB, cancer, and emerging diseases. We've got research in all those areas. But more importantly, we have continued to train our collaborators, but other institutions and health facilities and the government and everybody that we've worked with, we've continued to train since we established ourselves. In 2015, we've trained over 2,000 Nigerians. And this year, we're planning on training 500, all in the business of research. So, yeah, to answer your question, I'm very pleased. I am overpleased because really we have done exceptionally well. And I'm not surprised because I know Nigerians, I mean, anywhere you go, Nigerians are excelling. So once you've got the infrastructure, you have the enabling environment, we're going to excel right here. So I'm very pleased with how things have turned out.
All right. So talking about being pleased, do you think that Nigeria and maybe West Africa at large is paying enough attention to the health sector?
I think your question is really interesting because it's, in my mind, is twofold. On one side are the researchers, the scientists, and I think that we are really doing well in terms of developing young scientists. I think we're doing well. We can improve on ensuring that we, the established ones, continue to mentor younger ones and give them an opportunity. On the other hand, the other part of your question is the sponsorship. You know, so, you know, if you look at West Africa, research is something that is sustained for a long period of time. There has to be a dedicated effort and a sustained effort to make sure that that keeps going. So how are we doing on that? Not that well, because if you look at Nigeria, for instance, what is our budget for the health sector? And then you move on and say, what is our budget for research? What is our budget for innovation that can come out of the different institutions? It's really not much. So I think that aspect of it really has to improve. Here at IHVN, the way we survive is competing for international grants. We don't have any grant locally that says, you know, we'll like to give you this money, go and discover, go and do innovative research. No, we don't have that. We don't have that kind of support. But even in the U.S., I know that at the University of Maryland, for instance, when they established the Institute of Human Virology in Nigeria, the state itself devoted $5 million to that institution as like a basis for research for the next, I don't know, 5-10 years until they establish. This is in addition with the faculty getting their own grants. So you see there is some cushioning that allows innovation to really be done, because that's something that is sustained over a period of time. You don't discover new things every day, but you keep working at it every day for just that one day that you can discover. So on that aspect, I don't think West Africa or even Africa is doing.
COVID-19 is just one of the various infectious diseases that hits Africa and indeed the world in recent times. Don't you think that we need more virology institutions?
No, again, you're asking really, really pertinent questions and things that will improve the health sector in the country. We have known for years now, at least the science world has known that whenever we have an outbreak, an epidemic, or a pandemic, such as the SARS-CoV-2, is always caused by a virus. 90% of the time, it's virus. So that's why your question is really pertinent, that we need to continue to have institutions that will develop virologists that will continue this work. I mean, when you Nigerians some years ago, you talk about Professor Tomori as one of the top virologists. You talk about Professor Nasidi as another top virologist. So all the virologists are kind of easing out, and it's pertinent that we continue to train younger ones and that our institutions really pay attention to that. Now, if you look at the NCDC, for instance, and look at their website, 80% of the reports there are by viruses. Whether you're looking at Lassa or yellow fever or SARS-CoV-2, now we're talking about Nipah, Zika, MERS, all of these are viruses. So your question is really pertinent, and I think that some of the meetings that the government is having of brainstorming or engaging universities and research institutions must push these institutions to think that way and continue to develop virologists, because we're definitely going to need them. This wouldn't be the last time we're having a pandemic, and we better be better prepared next time,
Let's talk about projects targeted at people at the grassroots level, people who really need this sensitization. What have you done in that regard?
We've got a really strong department, which is community health, that works with the community. As you know, with HIV, we had a lot of orphans, vulnerable individuals that really needed support. So we've been involved in that, in targeting different grassroots communities, informing them, educating them about HIV, and to reduce stigma, to bring support closer to the people. In terms of research, really, there's nothing we can do in research without involving the community, because most of the time, either you're testing products that you're trying to find out whether it works or not. So that means you're telling the community and you're asking them to support you in testing this, as long as the product is safe. There's a very strong aspect of really working with the grassroots in terms of both the service that we provide and even our research, because sometimes, in fact, the community talking about your research is much better than the scientists talking about their own research as well. And then one of the areas that we do is we have here is a very strong communication department as well. If you recall, with COVID, there was a lot of hesitancy in taking the vaccines, despite the fact that the vaccines are safe and all of that. I, for one, have been vaccinated and have had boosters, maybe 4 boosters by now. But it was really difficult. I mean, the coverage is still fairly low in this country. So our communication department really goes out into the community and engage them. This is at the grassroots. This is what the vaccine is about. This is what it can do. And this is how it protects so that they can make informed decision. In fact, we have a blood drive every year where we explain to the community the importance of doing blood donation, but also the fact that here is what we do with samples that we collect for research. This is where we keep it, and we can destroy it at any time that you don't feel comfortable with. So engaging the community constantly in terms of what we're doing has really supported the work we do here.
In the coming years, what do you hope to achieve with this center?
I think the future is really bright for IHVN and this center. The goal of establishing this center was really to fulfill one of the visions for IHVN, and which is to be a center of excellence within West Africa, and I would even say within Africa and the rest of the world, that focuses on research that benefits the local health challenges, that is also focused on equity and working at international standards that I mentioned earlier on, within ethical norms that are respectful of the local culture. That is really the vision for IRCE, the International Research Center of Excellence. IHVN has the board. Our board members are very, very supportive, but they're also very careful to ensure that we stay within our mandate and we keep the progress of this institution going. So we've got scientists, we've got business individuals, we've got very successful, respected Nigerians on our board, and we know that they will make sure that we stay within our mandate and we work tirelessly to address the health challenges. In the next few years, my hope is, certainly in terms of the vision and the mission, is going to remain the same. But my hope is that the younger generations that we are mentoring and cultivating here will take over the reins and do exceedingly more than we have done in moving Nigeria to the level that it occupies its place within Africa scientifically as the giant of Africa in research as well, and in identifying solutions that are useful for the citizens of Nigeria and involve in discovery. So maybe the discovery for the cure of HIV is going to come from here.
That's the program for today. Thank you so much for watching. Don't forget to keep up with our past editions on youtube.com/channelsweb. Click on playlist, then scroll to Kaleidoscope. I'll see you again very soon. I'm Anne Nwawadu. Thank you for watching.